Select right or left hand device and use extension band if needed. Band 1, little finger side. Band 2, thumb side. Band 3, facing up towards thumb. Center the balloon target over the arteriotomy, the location where the sheath entered the artery, approximately 1 to 2 millimeters proximal to the skin puncture site. Step 1. Fasten band number 1 and number 2 tightly around the wrist. Step 2. Wrap band number 3 around the saddle of the thumb without any slack. Fill the syringe with 10 ml of air. Note, maximum balloon fill volume is 10 ml. Slowly inflate the balloon with air while simultaneously removing the sheath. Once sheath is removed, continue to inject air into the balloon until bleeding has stopped. The patient should be able to move their hand and wrist freely without bleeding. If bleeding is observed, inject additional air until bleeding stops.
We wanted to take a minute and show you some things that we've learned from our initial trials of placing this band and watching physicians place it. So I'm going to show you the way that we want them to place it, first of all. So you all know band 1 goes to the pinky side. So as we place it on top of our arteriotomy, we want to be sure that the physician braces the backer plate on each side as they pull and tighten the second band. And what we want to prevent is any kind of gapping here on each side of the backer plate, which you see that I just did. Now I'm going to show you what we've seen a few times from physicians is they'll put it on and they'll hold here and pull this around and they'll pull it tight. But as they pull it tight, they don't support right here. And what happens is you get this gap where you can put a finger in there and then you get a lot of movement, and it'll happen kind of on both sides of the backer plate. So once again, as we're teaching these physicians or techs to place this, we want to make sure that they support the backer plate as they pull around and support this area where they get a gap, pull tight and close the Velcro so they don't have gaps right there. Okay?